If you're facing chronic stress, you might be wondering whether all that stress in your life is having some damaging impact on your body in a way that you can't see. If so, this video is going to help you out. One of the most common and frightening health claims we hear is that stress causes cancer. But is that really true? Misunderstanding this can either cause unnecessary panic or false reassurance. I'm going to walk you through where the evidence is strong, where it's weak, and what the evidence actually says about the influence of stress causing cancer. And I'll go over the one distinction that changes how you should think about stress and cancer, so you're not misled by fear. To really understand the connection between stress and cancer, we need to dive into the field called psychoneuroimmunology. This field studies how three major systems in the body interact: the brain, the immune system, which is throughout your body, and the endocrine system, basically hormones. For most of the 20th century, researchers thought that these systems were largely independent, but around the 80s, researchers were able to show that the brain and the immune system actually communicate continuously, and signals from the brain can influence immune cells, and immune cells throughout the body send signals back to the brain. Around the same time, a pioneering neuroendocrinologist named Susan Lehman discovered neuropeptides like substance P, which play a role in pain, inflammation, and stress signaling. All of these discoveries help scientists basically understand that psychological stress can be a trigger for real biological changes in the body. And when we experience stress, the body activates two major symptoms: the HPA axis, the hypothalamic pituitary adrenal axis. Essentially, this is the system that secretes cortisol, and cortisol helps the body respond to threats. Short bursts of cortisol are healthy and normal. For example, if you're running away from a bear, chronic stress keeps cortisol elevated for too long, and that can cause damage to your body. The second system is the sympathetic nervous system, the fight or flight system. This releases things like norepinephrine and epinephrine, and these hormones remain high persistently when you're chronically stressed. It can influence immune function, inflammation, cell growth, and even tumor biology. So those two systems are the background of the question of whether stress causes cancer. So does stress cause cancer? This is the most important question, and the answer from major scientific organizations is fairly clear: that there's no strong evidence that stress directly causes cancer. For example, the National Cancer Institute says that while chronic stress harms health overall, evidence that it causes cancer itself is unclear and inconsistent. Similarly, there's large epidemiological studies generally showing no consistent link between stress and cancer incidence. For example, a 2025 systematic review and meta-analysis found no reliable evidence that psychological stress causes cancer. A 2004 review in the Lancet Oncology found that when lifestyle factors are controlled for, many apparent correlations between stress and cancer disappear. For example, you have to control for smoking, alcohol use, diet, physical activity, which makes sense, because when people are stressed out, they often smoke more, drink more, sleep less, exercise less, eat more poorly, and those behaviors clearly do impact cancer risk. But the stress itself is not the direct cause. However, even though stress may not directly cause cancer, researchers have noticed something interesting. In laboratory studies, stress clearly influences cancer biology. Let's look at three major mechanisms here. First, immune suppression. Stress suppresses your immune system. The immune system's job is to detect and destroy abnormal cells before they become tumors. And the two key players here, the two people in your army, the natural killer cells, sounds like assassins, right? And then the cytotoxic T cells. These two types of cells are really important for destroying abnormal cells in the body. Chronic stress directly suppresses both of these. Stress hormones also are going to decrease key immune signaling molecules like interleukin-2 and interferon gamma. And in animal models, we know that stressed animals develop more metastases when tumors are present, spreading of tumors. Now, the second mechanism is inflammation. Remember, inflammation is different from the immune system, and chronic stress increases inflammatory signaling molecules in the body. So there are things called cytokines like IL-6 and TNF-alpha. These go way up when you're chronically stressed. So inflammation can create a pro-tumor environment, because inflammation is a pro-tumor environment, and that will help these tumors survive and grow. So this inflammation is going to make a tumor that already exists be more likely to grow. Mechanism number three, stress has a direct effect on cancer cells themselves. So on cancer cells, many of them have receptors for beta-adrenergic molecules. And a beta-adrenergic molecule is a type of hormone or signaling connected to the sympathetic nervous system. And when stress hormones like norepinephrine go up, they bind to these cancer cells receptors, And those things can activate pathways that increase the tumor growth, increase tumor invasion, and increase what's called angiogenesis, blood cell formation. Angio means blood vessel, genesis means growth. There's one famous experiment that studied ovarian tumor cells, and when scientists exposed these cells to stress level concentrations of norepinephrine, the tumor invasiveness increased by 89 to 198%. So what they noticed is that there's an enzyme called matrix metalloproteinase, and that goes up in number. That allows these cancer cells to invade the surrounding tissue. So not only have they been able to show output changes, higher levels of stress and norepinephrine, more tumor invasiveness, more spread of tumor, but also they have a mechanism identified, a plausible mechanism. What's even more interesting than this is that these effects can be blocked by giving a medication called Propranolol, which is a beta blocker. Maybe you take Propranolol for blood pressure, performance, anxiety, if you play classical music, but a beta blocker can block the effect of some stress on the tumor cells. So if stress doesn't cause cancer, can it actually worsen cancer progression? If you already have cancer, can the stress make your cancer worse? This is where the evidence becomes more strong. So we know chronic stress can suppress the immune system surveillance, increase tumor blood vessel formation, enhance cancer cell migration, meaning the cancer cells are going to migrate throughout your body, and alter the tumor microenvironment to be more friendly to tumors because of inflammation. So there's a number of studies that are consistent with this, showing that cancer progression is affected by stress. One prospective study, meaning they follow people over time, of 159 cancer patients, for example, found that higher perceived stress predicted greater tumor growth and metastasis or spread of the tumors, accounting for about 33% of outcome variation after adjusting for gender. So 33% of the variation in how these cancer patients do could be explained by the stress effect. Other research shows that stress may reduce the effectiveness of certain treatments, including immunotherapies. So if you're taking an immunotherapy to treat your cancer, and if stress decreases your immune system, of course, it's reasonable that one would think the immunotherapy is going to be less effective because the stress is suppressing the T cell activity in your body. But it's important to be cautious. These are not all or nothing findings. Not all studies show these effects, and tumor biology is the main reason people progress with their cancers, not because of stress, but stress is a factor for sure. Now let's get back to what I mentioned earlier about propranolol. So beta blockers could be a promising treatment idea. Because stress hormones are acting through this beta-adrenergic signaling, researchers have been studying whether beta blockers could help. And a number of recent meta-analyses, studies suggest that beta blocker use is associated with improved progression-free survival in cancer, something like on the order of 22% less progression of the cancer. So there's emerging evidence that beta blockers may enhance the effectiveness of immunotherapies specifically. And immunotherapies are very important medications for cancer right now. They're keeping many people alive, and they've revolutionized oncology. So in early clinical trials, combining propranolol with a medicine that's an immunotherapy medicine in melanoma patients, response rates increased to about 78%. That's just one example. However, results are going to vary by the type of cancer that somebody has. And beta blockers, by the way, are not currently standard of care in cancer treatment. So we still need a lot more research. So what should patients actually do? Well, this is a really important discussion to have with one's doctor. But in practical terms, one should know that stress is not something that people should blame themselves for. Cancer is primarily driven by genetics, environmental exposures, lifestyle risks like smoking, sleep, nutritional factors. But managing chronic stress may still be helpful for overall health and quality of life. And evidence-based approaches definitely include things that decrease stress. So if I had cancer, I would definitely be focusing on physical activity if I could get to it, adequate sleep, 8 hours a day, therapy if I needed that, mindfulness, meditation, stress reduction, strong social support, and even religious participation, which has been shown to benefit mental health and decrease mortality, extend lifespans. These strategies can improve mental health and help immune function in the long run. So in conclusion, stress doesn't cause cancer, but it can definitely have an effect on tumor progression through immune function, inflammation, hormone signaling, and the tumor microenvironment. If someone already has cancer, stress can likely contribute to its worsening, but the field of psychoneuroimmunology, which is very fascinating, is just getting started. And as we all know intuitively, our mental and physical health is far more interconnected than our culture typically represents. So consider with your doctor how this information may apply to you. If you have cancer and you want to prevent recurrence, If you don't have cancer and you're trying to prevent cancer, if you found this helpful, share it with someone you love who might need it. Check out this other video here, and feel free to subscribe to my free newsletter to get more in-depth scholarship on these questions, and also more of my personal take on clinical issues. Thanks so much. Take care.